Hi, I'm Kathy with Level Up RN. In this video, I will be discussing niacin, and specifically how niacin is used to treat high cholesterol. And then at the end of the video, I'm going to give you guys a little quiz to test your understanding of some of the key facts I'll be covering. So be sure to stay for that. And if you have our Level Up RN pharmacology flashcards, go ahead and pull out your flashcard on niacin so you can follow along with me and pay close attention to the bold red text on the back of the card, because those are the things that you are likely to get tested on. Niacin, which is vitamin B3, is a water-soluble vitamin. In high doses, niacin is used to treat hypercholesteremia or high cholesterol. It works by decreasing synthesis of triglycerides, and it also decreases synthesis of LDL, which is our bad cholesterol. So L for LDL and L for lousy. Niacin also increases levels of HDL, which is our good cholesterol. So H for HDL and H for happy. It does this by reducing the rate at which HDL is catabolized or broken down. A key side effect of niacin is flushing of the face. Our cool chicken hint to help you remember this side effect is my face doesn't look very nice because it's flushed after taking niacin. Other potential side effects include gastrointestinal upset, pruritus, which is a fancy name for itching, and hyperglycemia or elevated blood glucose levels. And like other cholesterol-lowering medications, niacin also carries a risk for hepatotoxicity or liver damage. In terms of nursing care, you'll want to monitor your patient's liver function, including their ALT and AST levels throughout therapy, due to the risk for hepatotoxicity. It's also important to note that niacin should be used with caution in patients with diabetes because it can cause an increase in blood glucose levels. All right, it's quiz time, and I have 3 questions for you. Question number 1. How does niacin affect LDL, HDL, and triglyceride levels? The answer is it decreases LDL and triglyceride levels and increases HDL levels. Question number 2. Why should ALT and AST levels be monitored during niacin therapy? The answer is due to the risk for hepatotoxicity. And question number 3, hypoglycemia is a known side effect of niacin. True or false? The answer is false. Niacin actually causes hyperglycemia or an increase in blood glucose levels. All right, that's it for this video. I hope it was helpful. If so, be sure to hit that like button. Take care and good luck with studying. You'll want to monitor throughout therapy due to the We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.